Yes.
Yeah.
Good afternoon, everyone. We are back in the House Healthcare Committee for our last piece of testimony for today. And we are going to back to what we started with, which is testimony regarding the Governor's Budget Adjustment Act request for youth inpatient beds. So we have 3 witnesses with us today, and we're going to listen to their testimony, and then we'll move on with questions. So Lori, if you'll introduce yourself for everyone and then go right into it.
Sure. Thank you so much, Chair Houghton. My name is Lori Emerson, and I am the Executive Director at the National Alliance on Mental Illness of Vermont. And just want to welcome all of the new members to the House Healthcare Committee.
You know what? Actually, Lori, let me real quick, because we haven't introduced ourselves, and many of you will be back with us. So let's just do a quick round here at the table for everyone, so you know who you're talking with. Thank you for that reminder. Art?
Yes, Art Peterson from Clarendon, represent Clarendon, Wallingford, West Rutland, part of the town.
Leslie Goldman, Wyndham 3, Rockingham, Brookline, Westminster, which is the Bells Falls area.
Daisy Rebecca, representing Winooski.
Mari Cordes representing Lincoln, Moncton, Starksboro, and Bristol.
Jonathan McFawn, I represent Barrytown and Piece of Williamstown.
Lori Houghton, City of Essex Junction.
Alyssa Black, Northern Essex.
Ryan Chena, Burlington.
Alan DeMar, representing Montgomery and Enosburg.
I'm Joe Andriano. I live in Orwell and represent Shoreham, Whiting, Sudbury, and Hubbardton as well.
And I'm Bobby Farley Rubio, and I represent Barnet, Reigate, and Waterford.
Great. Thank you, Lori, for letting us interrupt you. So please continue.
Oh, no, we appreciate that. Thanks so much. And thank you for allowing NAMI Vermont to provide comment on the governor's proposal fiscal year 2023 budget adjustment to expedite the funding for a youth inpatient facility. Just so some of you know who we are, NAMI Vermont is a state chapter of the National Alliance on Mental Illness, and we're a nonprofit 501c3, a grassroots organization that has volunteers that help us administer all of our programs. And our 3 cornerstones that we focus on are support, education, and advocacy. So our core competency is our lived experience as a family organization. So thank you for welcoming us here today. NAMI Vermont supports the investment from the state of Vermont to establish a youth inpatient facility. And we applaud the efforts of the state to integrate mental health with physical health, to collate a youth psychiatric facility at a medical hospital to support children with complex co-occurring needs. And we appreciate the Southwestern Vermont Medical Center's proposal to establish a youth inpatient facility and stepping up as the sole bidder of this project. So there are several factors that we want the legislature and the state to consider when finalizing this offer. And we ask that you include family-based organizations and other family members who have first-person experience with the system of care in the feasibility study to learn from them about their needs, their requirements, experiences, and their challenges. And there are 3 nonprofit family-based organizations that serve the state, and they include NAMI Vermont, the Vermont Family Network, and the Vermont Federation of Families. So we ask that you listen to the voices of first-person experience through our network of families and include those families as you make those critical decisions to invest funding to support children, youth, and families. So when Tropical Storm Irene swept away the Vermont State Psychiatric Hospital, the state rallied to find a solution to place patients in their own community hospital where psychiatric units were established. And our children and youth deserve the same respect and consideration, to be close to home, near mom, dad, their siblings, and other support systems. Establishing a second inpatient facility in the southern part of the state does not consider family needs in the northern and central part of the state. Will transportation and lodging be provided to these families? Although there is a facility for children at CVPH, we've heard from families that it is not accessible and meeting the needs of Vermont families who need care. And there have been several suicides by youth in the Northeast Kingdom. We need facilities and hospitals throughout the state. We need other hospitals sending in a proposal to support their community and establishing a collaborative partnership with the hospitals and state would be a more proactive approach. Of course, we understand too that there are capacity and staffing issues, and there are many complexities to work out. We strongly recommend that there be a facility for children for all ages up to age 18 with complex needs. The Southwestern Vermont Medical Center proposal noted serving youth 12 to 17 years old. And we hear from so many families who have a very young child who is symptomatic due to trauma or had complications in utero or shortly after birth. All ages struggle with complex needs. So how will the new youth inpatient facility serve out-of-state patients since there's that great need? I guess that's just one question that I have. Could there be additional funding coming from out of state that could help Vermont to establish more than one facility in a different region of the state? And I'm sure you've pondered all these questions yourself. And as you collect data from the Department of Children and Families about youth waiting to be placed, please consider that there are families struggling at home who are not involved with DCF, who have lost hope or faith in our system of care because they are repeatedly sent home with no facilities or care available for them. The need could be much higher than the data that DCF shares. It's so traumatizing for a young child to be stuck in the emergency room or in a facility far away from home. They need their family support, and we need facilities and care in all areas of the state. So let's care for and treat our youth now so that they experience recovery and resiliency and don't grow up to require the adult mental health system of care. Thank you so much for listening to my comments and your commitment to support youth mental health.
Thank you, Lori, very much. We appreciate those comments. Kathleen?
Thank you, Madam Chair Houghton. I really appreciate this opportunity to provide comment on the governor's proposal for FY 2023 budget adjustment to expedite the funding for the youth inpatient facility. Today, I'm going to combine my professional and personal roles as I speak to you. I have been working in Vermont elementary schools for the past 28 years, the last decade plus as a principal. In addition, I'm a parent of a child who required mental health supports and services. And I'm here to share with you that my son was tethered to a bed in an ER for 11 days in a room with no windows. In addition, my professional role currently is that I am the executive director for the Center of Health and Learning. CHL provides suicide prevention training, awareness, and education across our entire state. We also support those who need substance misuse assistance, and we train those providers who give direct services to those populations. Mental health and wellness are at the center of all we do in our prevention work at CHL, as we're not only an agency of response, but one of upstream thinking and prevention. So I provide that as my introduction to my further comments, because I come to you today with 3 hats on.
Great.
First of all, both as a consumer and a provider of these services, I'm really delighted to hear and to know of the governor's support for a 12-bed inpatient wing that's being developed. This is a really high need, and there's, as you know, a lack of available and accessible mental health supports for our teens ages 12 to 17, as I understand it in this proposal. So as this project becomes more finalized, I would like to share some recommendations and considerations from my lived experiences. And I have just 4 points to make. 1, as an elementary school principal, I can testify before you that there are many, many children under the age of 12 who are in acute crisis daily. The pandemic has left us with so many children who have lived and experienced trauma for an extended period of time that this really requires significant support just to maintain even basic safety and self-safety. Just last year, I had 2 students in kindergarten, both age 5, who used suicidal language and their bodies to communicate their level of need to trusted adults at school. This is really a shift in the past 10 years in schools, with the younger populations having more complex and coexisting needs. In addition, please be aware that the developmental ages of the children matter in location and services. When my son was in an ER for 11 days, we were housed directly next to adults who were in mental health crisis, who loudly shared their needs, thoughts, and actions. My son had to observe and hear those comments, which was, as you can imagine, extremely triggering to him. It caused him to feel unsafe in a space that should have been his safe haven. So as you design further beds and supports, please keep in mind that younger populations need to be separate from that of teens and adults. Lastly, as Lori mentioned, we know through research and countless studies that early intervention is best. If we can support, educate, and regulate our youngest children, we may not actually need to see them again and serve them as teens and adults. Point 2, the location of this proposed facility being in the southern part of the state leaves 2/3 of our state in our current predicament, which is lack of access due to travel, time, and transportation needs. Since Brattleboro Retreat is already located in the same area, locating the new beds in central or northern Vermont would likely increase access and eliminate some of the barriers that are now in place for families who are trying to engage with the services that are needed. Our hope is that the location will be carefully considered so that it serves as many youth as possible. And again, we appreciate SMV stepping up and being willing to do this work. 12 beds will be of help. And if we can be as intentional as possible, that would be ideal. Point 3, please use family with lived experience in your planning and vetting of these important details of the projects. We are the ones as the consumers of the service who most clearly can share what has worked and what is needed. The distinction between families of children with complex needs and those of professionals who may be planning these services is the lifelong 24-hour nature of the family stressors and needs. There's no way to turn off my son's neurodiversities. They're with us always. Please ask families about their journey and listen to them carefully as they respond. I, for one, am happy to provide further information for anyone who's interested in making systems improvements. 4th, during that experience, I had a youth director in a designated agency in Vermont literally say to me while my son was in the ER for 11 days, if you could just sign him over to DCF, you would probably get a placement more quickly for your son. What an awful thing to say to a loving family who is using every resource they could find to support, nurture, and care for their child. I, of course, did not heed that recommendation, but that should not have been the reality of my choice as a parent. Please remember that while children in custody need service and support, so do those that are still living with their families. Service is needed for both those populations. Lastly, I'm really hopeful to hear about this proposal and the addition of services and beds. Our need is great in Vermont. The needs are here, the needs are now. We can and need to do better by our children. Thank you for your time and consideration in this important matter, and I'm happy to answer any questions you have. Thank you.
Thank you, Kathleen. And thank you for bringing your personal story to the table. We appreciate that. Alexina.
Hi, everybody. My name's Alexina, and I am a member of Vermont. I was born in Bennington, Vermont, and so I'm from the southern part of the state. I grew up here, and I struggled with my own mental health challenges. I continued to struggle with my challenges through my teenage years and was silent about it until a moment where I was in college and had an experience that made me realize what I needed help for and made me realize how many stigmas I was internalizing by the things I was hearing around me. I am now Miss Vermont, and I am a mental health advocate. I am not only a member of NAMI Vermont, but I am also a founder of a nonprofit that focuses on providing programs directly to Vermont students and talking to them, talking to their families. And so that has been my journey for the past 9 months, traveling all over Vermont and talking to students. And so I would like to present that kind of expertise of my personal lived experiences, as well as a mental health advocate and someone who talks to kids on a weekly basis. So thank you so much for welcoming our thoughts as a mental health advocate, community members, and organizations. It's so important to share our experiences and expertise when you are making your decision through the state. As a Vermont lifer, someone who has also experienced mental health struggles and a mental health advocate, it is crucial that youth inpatient facility is funded and is continued to be talked about. I have traveled all over the state as Miss Vermont to talk directly to teens and their family members about mental health. And my goal was to connect people to resources and share my story to hopefully destigmatize mental health. However, when I realized the amount of youth struggling with mental health is so much greater than the statistics show and so much greater than people talk about. The biggest takeaway through talking to hundreds of students as well as parents is that there is a huge lack of mental health resources in this state for teens and for kids. Wait lists of over, and these are things that has been told to me by students and by parents, wait lists of over 6 months to get an appointment with a mental health professional, parents not knowing where to turn to because they've been turned away so many times, and some who have actually left the state to receive professional help because Vermont could not aid their child. This is not even to mention the amount of youth who are afraid of sharing their struggles and are hiding it just like I was as a teen. This is not only needed so much more than any of us know, but so much more than even the students realize, because there are so many new struggles. As Kathleen mentioned, with the pandemic, that has created so many more instances of stress and long-term trauma for these kids. This all means this emergency inpatient help is becoming more and more important. This proposal is not just important, but it's also necessary. And we need to help our youth, and we need to do it before it's too late. I know it's out of control to control who accepts bids and who puts bids out there, but ideally, in a perfect world, we need more care throughout the entire state of Vermont. I have talked to many parents from the northern part of the state who have mentioned how hard it is to have their 6-year-old son at Brattleboro Retreat in a place that they can't see them. This not only affects their lives, it affects their jobs, but it also affects the healing that these kids need when they are so far away. It is so hard and so much harder. So in an ideal world, I think having something in part of the northern state would be an ideal choice. But if the only choice is Southern Vermont, we need to swiftly approve and provide more care for health and wellness of our teens so that they can be the future leaders of this state. Thank you so much.
Great, thank you. Very well put, that they will be the future leaders of our state, and we need to help them now to get them there. So thank you all. We're going to open it up for questions. Anyone have? Joe?
Yeah, first of all, before I ask my question, I want to thank all three of you for speaking. Lori, thank you for advocating for this. Alexina, thank you. As a person with mental health problems myself and troubles myself, thank you for advocating to take away the stigma. And Kathleen, thank you for sharing what happened with your son this morning. We met with a nurse and a doctor, and I asked them, where are the stories about the children in the emergency room? Because it's very easy to look at a number on a page and say, well, there's 3 youth waiting for more than 7 days, and that's a number on a bar chart. But it's when you tell that story, when you say what happened to your son, when you say being in that room, tethered to a bed for 11 days around adults having these things, that thank you for sharing that. More people need to hear that. My question is, and in this question, I mean no disrespect, because I just want to be clear as to what you are asking us, because it's my understanding from the testimony that we heard several days ago And as you said, there was a bid process, and I don't remember if 0 bids came in and they rebidded it, or if 1 bid came in.
So let me clarify the bid process, and then you can ask your question. So there was a proposal RFP that went out a while ago that one hospital replied to, and it was supposed to be done at in Berlin. I forget the name of that. I always get the acronyms messed up. And then they pulled out due to financial reasons. An RFP was put out again this fall, and the only entity that replied was Southern Vermont Medical Center. The bid was it was very flexible, as the commissioner stated when she was here. So it was for a range of beds. So I think in the language we're seeing in the BAA, it says 9. They've said 12. That's because the RFP was for a range. And so, yes, they were the only one that responded.
Thank you for the clarification. Yes. I guess my question is, because I just want to be 100% clear what you're asking. Are you encouraging us to approve that, but just trying to tell us, like, please take the rest of the state into account? Or are you saying, please don't approve that because we think it's so important for that to be elsewhere in the state because Brattleboro Retreat is where it is?
We definitely support the approval of the funds to be able to have a youth inpatient facility. What we are wanting you to consider, we appreciate if it's just Southwestern Vermont Medical Center, then that's what we would advocate for as well. But that's not serving the needs of the state. If they pull out, which we don't know after the feasibility study, ensuring that the Department of Mental Health does have that money earmarked so that maybe they can negotiate with another hospital to maybe have it even dispersed out further. I know the state has money that came in through the COVID relief. Is there extra money for maybe establishing more youth inpatient? And, what I understand from the commissioner, it doesn't matter if we have 6 beds here and 6 beds there, that it would cost the same for each one. That would be good to revisit and to see, how can we partner with more hospitals to be able to do this? How can we negotiate instead of putting out to bid, whoever raises your hand gets it? No, there is a need in every area, every community. And how can we get to work with the hospitals to meet all needs?
Thank you.
Did that help clarify, Joe?
It did, yes, thank you.
Can I add for just a moment to Lori's comment?
Yes.
I would agree. 12 beds are better than no beds, regardless of where they are in Vermont. And those beds will be filled quickly and immediately, I'm guessing. And as Lori said, in addition to just the number, perhaps in future planning, there are designated areas and or age parameters or sort of things to keep in mind as we're building an infrastructure. It's definitely 12 beds would be better than none. When my son was in the ER for 11 days, we were refused placement in 6 states, not just Vermont. He has learning issues, and no one apparently has thought of the fact that someone who might be cognitively delayed, have medical issues, and also have mental health issues. So we were told he didn't fit the milieu, not in Plattsburgh, not in anywhere, because he can't sit in a circle and express his feelings verbally, because he doesn't write complete sentences in a journal, right? So not only, that's just another conversation, another niche, but for kids who have complex coexisting needs, it becomes even more difficult. So we were denied, I think, 12 placements in 6 states in 11 days. So he was discharged to my living room with no service.
Wow.
Because Medicaid stopped paying for the bed.
Right. Any other questions?
Did you eventually find, did you eventually find your son a place?
No, he did not receive inpatient care anywhere. I have the blessing of having the opportunity to have a formal education. And I'm able to express my wants and needs clearly and know that there is a hierarchy within our state. And I chose, out of desperation, quite frankly, to get involved with people like Diane Bugsby, who was the director of disabilities for the state. Cheryl Wilcox joined our team. The person who does care quality and control for Medicaid Vermont joined my team. I honestly was very fortunate to have people at the table for that discussion, elevated that discussion to a level that got the attention of people who had the ability to make some changes and decisions, who controlled purse strings, who were kind of outraged by this case that the journey went not as it should have for a variety of reasons. And so I was able to get some key players at the table, and an exception was made in this case. He did remain with me, but we live in one designated agency area. That designated agency was not able to meet my son's need in any way, shape, or form, as described by their youth director. I should just sign him over. It would be easier. And there was a DA 15 miles north of us that had much more service. And so there was a very unique arrangement that has been made on my son's behalf, where the local DA where I live contracts to the DA with more service and provides him with support. So he now has a shared living provider and lives with me part-time and part-time one-on-one with someone who has expertise. He attends a private school in state for children with differing abilities, that Belkate School, which has been phenomenal. If you don't know about Belkate School and you know anyone with neurodiversities, I highly recommend it. Amazing place for young people to grow and be accepted for who they are. And I have a strong team around me now, but we have a really unique, and I'm going to dare to say Cadillac plan that I was able to attain because I didn't give up. And it took me probably 2.5 years to get it. From the time he was in that hospital bed to the time we made that arrangement was about 2.5 years of constantly telling the story, constantly meeting, constantly asking, not giving up. And we have a really unique RAP team. He's highly safe and successful right now. So it does have a happy ending, fortunately. But not what does the parent do that didn't graduate high school, that doesn't know there was a Diane Bugsby? What does the parent do who doesn't have the chutzpah to keep asking tough questions, or to sort of buck up against the experts who tell you, just sign him over? That would make things easier and he'd get what he needs. Like, so yes, I'd be happy to talk more at another time. But yes, he is well. Thank you for asking. And part of the reason I'm in my current role is around systems engagement improvement. We do work in suicide prevention and unfortunately at times postvention. And I can tell you of the recent cases, 5 past suicide cases I'm aware of, 3 of them were in youth out of those 5, and 3 of them were in the Northeast Kingdom.
Wow.
That's the most recent stat from October to now.
Yeah.
We've had 5.
You know, Kathleen, it's such a good reminder to us that, you know, we hear from people, right? But we don't hear from everyone because they may not have the resources. And so you're able to advocate for yourself and for your son. And there's many, many, many who cannot, and also cannot share their story with us, right? So.
And my first goal, honestly, in this work was to get my son what he needed. And the second goal was to get everybody who was in this position what they needed that didn't have a parent who had the opportunities and blessings I had.
Yeah. Thank you for sharing.
Thanks for listening.
Any other questions or thoughts? Great. Thank you all very much. I know this was short notice. I appreciate, Lori, you reaching out and offering the testimony, and glad we were able to get it scheduled on short notice. We will obviously keep your comments in mind. I know Lori sent written testimony. I apologize if
I did as well.
You did as well? Okay, great.
I did it like 5 of 2, to be completely honest. Yes, it went in your inbox at 5 of 2.
Okay, great.
I also work today, so.
Oh, thank you. And Alexina, you can send written testimony, or with this, this is always on YouTube now, so we'll be able to come back and review your thoughts. So reach out anytime and have a safe and wonderful weekend. Thank you.
Thank you.
Thank you for your time and the opportunity to listen carefully. Thank you.
Absolutely. So I would love to have a discussion, but it's snowing. I think everyone should try to get home and travel safely. And we will be back on the floor Tuesday at 10, and we will be here at 1 to make our final recommendations on BAA. So